Hello, I'm Laura Meyer, and today I'm joined by Anne O'Neill, founder at Adora Digital Health. And thanks so much for joining today.
You're welcome. It's great to see you, Laura.
So, Anne, could we start by you telling us what your business does?
Sure. So, as you said, I'm founder and CEO of Adora Digital Health. We're a women's health company and we're focused on helping women understand and manage the menopause. So, we built a health and wellbeing platform currently distributed by employers so that their female employees can stay thriving during this time of life.
Brilliant. So, could you talk to us about your journey into entrepreneurship? What motivated you to start your own business?
I think I always felt I had something big in me in terms of career. I was quite senior within the broadcast industry, so within two media owners, essentially Viacom and Global Radio, which was then called Capital Radio. And I was partnership director, commercial director in those organisations. And then when we had our third child, I stopped because it wasn't easy to marry full-time work with young children. So I had a sort of big motherhood career break, and it was really difficult, actually. I really, really felt the loss of not being in the workplace. So I was determined to come back. And in that time, I read a lot about people who had started businesses and who were doing things in the mental health space, really. So as I started to go back into the workplace, I ended up working within startups as a marketing commercial consultant within mental health, within women's health, women's content. And I sort of caught the bug there. And I then had this lived experience of a terrible perimenopause where I didn't recognise the symptoms and I was thrown off track for a couple of years. And it was at that moment when I combined the desire to do sort of something big in the workplace with an idea that I felt needed solving. And that's where Adora came from.
And just going back to Adora and what it does, how have you found the response since you started Adora with women's health and menopause in particular being so much in the media now as well? And I know you've had a long journey with Adora, relatively so for over the past few years. How have you found the response in general?
So it's interesting because you're right. We started Adora before really this current wave of awareness and when I was talking to people initially, it was very much in hushed tones, and people very much looked bemused when I asked them what workplace benefits they had in place for women going through menopause. Often employers had never had the conversation at any level in their organisation. And women themselves, I was often the first person they'd ever spoken to about how things had changed for them. I'm really pleased to say that there is much more awareness and things have changed. But I think women are just as confused and there is a lack of good, trustworthy advice. So in answer to your question about the response to Adora, it's been overwhelmingly positive because our approach to building the platform has been always to work with the most important stakeholders. So women are at the heart of everything we do, but also we've stayed very close to clinicians and the healthcare service. And we've always made sure that what we're building is a solution that employers will want to adopt because it really is making a difference in their workplace. So it's been really positive.
Right. So did you have a co-founder or have you done this solo? And what was your thinking when you started out about having a co-founder?
So I'm really collaborative. I believe in the power of a team. I spent probably the first 6 months doing my desk research and really understanding the problem. And then when I had a bit of an idea about a good tech solution, I reached out to somebody who had been mentioned to me as an absolute expert and fantastic guy, Ed Smith. So Ed and I worked together for a bit, and then I thought I can't do this without him, and I loved working with him. So I asked if he'd join me, and he became my co-founder at that point. And then the other third sort of really key person who worked with us in those early days is Dr. Karen Morton, who was a clinician, NHS consultant, gynecologist and obstetrician. And she was excited about the idea of scaling healthcare in a personal way, because she, for 30 years, had seen women in crisis who had come in to talk to her. And if only they had had the tools to understand what was going on and seek treatment earlier, their lives wouldn't have been, they would have suffered as much as they've suffered. So she was very keen to try and create a platform that enabled all women, no matter who they were, to access the things they needed at a moment of need.
So at the beginning of the journey, did you join an accelerator program or a boot camp? And if you did, why did you? And if you didn't, why not? And if you did it benefit you?
So at the beginning, I made a decision not to give up work so that I could focus.
Mm-hmm.
So I essentially bootstrapped at the beginning.
Mm-hmm.
And then when I met Ed, we realised we needed some funding. So we started applying for government funds like Innovate UK,
Mm-hmm.
funding like that. But our first piece of funding was through an accelerator run by a great company called Start Codon, who are Cambridge-based. And that was an accelerator and funding, which enabled us to basically build the prototype and launch it on the App Store. And we needed funding to do that. We didn't have the means to bootstrap our way to that.
Mm-hmm.
The accelerator also gave us access to some of the professional services that we needed as a startup, so legal, IP, insurers.
Mm-hmm.
So it felt like a really good thing for us to do. It was a successful move, actually.
Right. So something that you would say to others, look into that, because it could be helpful.
I think so. I think you have to be aware. I think you have to really think about the outcome and think about the stage you're at, because there's an awful lot of accelerators. They're not all the same. For us, we were very strategic about our decision. We were joining a health tech accelerator, and it really helped us understand the landscape and the sort of environment that we were going to be operating in, and that accelerated relationships for us. So not all accelerators are equal, I would say, and be really careful, because they do suck up your time. So if strategically it's the right time and you can really see it accelerating you in your journey, then I would certainly consider it.
Mm-hmm. And of course, you give up equity as well. So
you do give up equity. So that's a real consideration.
Mm-hmm.
I also think that you've got to put a lot into it.
Yes.
And we did, and we have great relationship with the people that we met there still to this day. So it worked for us, but we had to put quite a lot in as well.
Yes. Okay, great, thank you. So what was the right point for you to raise investment after the acceleration, after you'd done more work on Adora? And how did you find the fundraising journey?
So I think it's been really tough, actually, the fundraising. So neither Ed or I have an investor background. We didn't have a network. We didn't understand investment. So we were learning all the time. We spent a lot of time talking to the wrong people at the beginning. We were too early stage for the people we were talking to. And so we weren't quite the right shape for them. Once we learnt this, and once we sort of pivoted to an angel group, when we met Angel Academy, when we met Cambridge Angels, it became really clear, really obvious to us that we were now talking to the right group of investors.
Right.
But we sort of had to learn that ourselves. I suppose on the positive, we now have a network, because we talk to people who are actually still interested in our development and want to talk to us now. But at that stage, we didn't quite understand the fit. And we, of course, we were so optimistic, and we understood the problem, the size of the problem we were fixing. We found it hard that others didn't see didn't see it in the same way as us. So it's like, why not? So. But it was, it took us a long time. I think I led, as female investor, female founder, I led that. And I think, there's a small amount of VC funding that goes to female founders.
Yes. So So it's difficult. Yeah, still only 2 to 3%. So absolutely. Yeah. So can you tell us, Sam, what's been the best and the most challenging aspects about what you're doing?
I think we're really making a difference in women's lives, and in some instances transforming the way they feel about themselves, about their work. We're also doing it at scale, so we're doing it in big numbers now, and that's really exciting. And that's great to know that we're really doing what we set out to do. We're working with some brilliant people. A lot of people have experienced poor treatment in primary care and secondary care, and have sort of joined us and are aligned in the mission to ensure that no woman gets left behind in this democratizing healthcare. So those are some of the absolute highlights. Also, we have great relationships with our investors, and we enjoy the interactions, the learning, the support that we get from them. So that's all been really, really positive. On a personal level, I've been really interested to see exactly how much I'm capable of. So where are my boundaries? Because so much is expected and required of you, from presenting all the time now and presenting all the time, to raising funding, to turning up at events and having to spend 3 days with strangers and just try and get them to buy your product. There's been so many challenges, and I've actually quite enjoyed it. I've enjoyed the challenge. I think the worst is, though, this sort of constant need to just to keep multiple plates spinning, not drop any of them.
Yes. And what about people that have joined to work with you, either full time or part time? Was that something that came easily? Is that been a good experience, or has it been tricky, especially on the tech side, to find the right people?
No, it hasn't been tricky. I think we've been really fortunate. I think worked with a lot of people who've got quite a lot of experience as team leaders, as a manager. I also think that what we're doing appeals to a lot of people.
Yes.
So it hasn't. In fact, we've been going for about 4 years, and nobody's left us, actually.
Well, that says a lot.
I think so. So nobody's left, and we are still small, but we have a number of consultants that work on a sort of as needs basis, and we can keep in touch with them. So that hasn't been a challenge for us, actually.
Brilliant. So, Anne, give us your top advice, please, for anybody watching who is at the beginning of their startup journey. What's your top tips?
Well, I suppose I would say it is all encompassing, and it does take over your life. And it is it's not 9 to 5. It is 7 days a week, and it is every day. Just make sure you've got the space in your life for that, because there are a lot of sacrifices that you have to make. Certainly, I felt this. Things drop away because you just have to focus on getting things done.
Yes.
Just be mindful of that. And if that is your experience, I think it's normal. Whether it's right or not, I think it is normal. And it can be hard. I think, though, on the positive, being able to make a difference and to build in a virtuous way. So we want to build a global company. We want to be a recognised women's health brand, but we want to do it in a really virtuous way. We want to leave no woman behind. So we're working with the NHS to ensure we have a public sector strategy. We want to make sure that at all times we're doing the right thing, and to be able to influence a business in that way is very, very motivating. So I think think about the timing in your life. Is it the right time, and are you going to be able to justify the sacrifices that are going to come? Don't give up. It's hard. Try and look after yourself. And just keep going.
Brilliant. And I think you've also mentioned their motivation. You've got a strong purpose that you want to fulfill in terms of providing women's support for women and their health. So how purposeful I think it is for somebody as well, what they're doing. Because as you say, it's a huge sacrifice, and it's probably the hardest thing you're going to have to do in terms of work. So it's making sure you feel it's worthwhile, right? On whatever level it is, whatever that means for you.
Yeah, I mean, people will have their own individual motivations.
Exactly.
But I think it's absolutely key. So, mine come from my experience of having to give up work very early before I really had a sort of senior experience and wanting to prove to myself, but also just to see what I was capable of. So that was very personal, married with something that I feel really strongly about, and I felt was needed some power and strength behind it, and I was certainly wanted to be part of that solution. So those two things together worked for me.
Thank you. And finally, what does the future hold for you and for Adora?
So we've been going for 4 years. We're hoping to raise a large seed round next year that will enable us to scale the systems that we've been busy learning and implementing over the last 4 years. I really want to be a global company. So, we're already thinking about global partners and already in conversations about expansion there. And really just to keep going and to keep progressing and to keep learning it myself personally, to keep on this road and to see where we get to in 5 years and then in 10 years. And that's what we're doing.
Great. Well, Anne, thank you so much for joining today. Fantastic to hear what's happening with Adora and about your startup journey. Thank you for sharing.
Thanks, Laura.